I'm Chrissy Roberts, and I'm here on the Brooks Report Live talking with Dr. Jeffery Thompson. He's a boarded and practicing emergency medicine physician in Southeast Texas and medical director for Best Med Urgent Cares. Thank you for talking to us, Dr. Thompson. I know you're busy.
Oh, no problem. Thank you for having me.
I know that a lot of people are just plain tired of talking about COVID, but now is not the time, is it?
No, we're kind of right back into the startup of a new surge and continuation. So I think now is the perfect time to be talking about it.
Now, when we talk about the uptick, some of that was expected when we reopened, right?
Yes, we kind of expected as everybody was locked down. Most cases are kept apart. People are staying apart, and as we open things back up, people will be in contact with each other because of the virus. Normally, people who get in contact are going to get sick, usually 4 to 7 days, but it can be delayed as much as 15 or even reports of up to 30 days. So as we reopen back up, people are going to be exposed. But because we've reopened back up and so many people have gotten close and not really recognizing social distances, we've really seen a bigger uptick than expected.
We hear so many different stories and people just flying facts around. How much is COVID-19 affecting your ER? What are you seeing right here in Southeast Texas?
We've seen a huge uptick since the original. When we first had our lockdown in place and we looked at the end of March and April area, there were people with concerns, but the positives were actually very low. The area in Southeast Texas as a whole did a great job of locking down and keeping things. We're starting to see surges that are consistent with what you're hearing about in the media. The hospitals are not overrun, but at least 40%, if not half of the patients we see are something that are COVID or COVID related. And that's a huge uptick from what we saw back in April.
When should somebody get tested?
Main things to be tested for, I think before even thinking about testing is if you've been exposed or you're starting to have symptoms for the majority of people, the most important thing at that point is quarantine. Getting tested will verify what you have, but there's not really any approved treatment for most people who don't have severe disease. So if you've been exposed, think you've been exposed, or think you've been tested, your first thought should be, I need to quarantine. I need to keep myself away from other people. But if you're experiencing symptoms being most commonly we see now are fatigue, cough, shortness of breath, ongoing weakness, sometimes stomach symptoms like vomiting or diarrhea, but to the less so, then that would be a good time to see about getting tested. You also, if you're just exposed and you're thinking, okay, I got exposed to somebody that they called me and said yesterday they tested positive, there is a delay before onset of symptoms. So I usually recommend to people, if you've been exposed to someone, self-quarantine. Once you get to about day 4, 96 hours up into about day 7, that'd be a good time to test. If you run into someone who you were at HEB last night, or you were at a grocery store, you were at a department store, a restaurant, or somewhere, a friend's house, and they say, hey, I tested positive yesterday. If you run out and get tested that day, you're more likely than not going to test negative because the virus hasn't had time to catch up and be prevalent. So my recommendation is usually wait at least 4 days from exposure. If you're having symptoms, then those are okay times.
Okay, so if you know you're exposed, like wait a couple of days, up
Wait,
to 4 days.
yeah. If someone says, hey, I was positive and you've been exposed, and even if you were wearing a face mask or something else, wait. And quarantine. Don't think, okay, I've been exposed. I've got a few days. Let me run around and still go to the grocery store, still go to the drugstore. Just stay home and stay away from the rest of your family members. You've got all sorts of delivery services. There's not almost anything in our world today that you can't get delivered to your house. But stay away and try not to expose other people. That's the link at which at some point we've got to be able to ensure and stop, is that people who are exposed or possibly positive are self-quarantining and staying home.
If you have a question for Dr. Thompson, please put it in the comments. Do know that there's a little bit of lag time, but we will try to get to it most certainly. I wanted to ask you about the testing. There are so many different tests that are advertised. Are they all the same?
No, there's multiple different that are available. So if we look back towards the beginning and what's most commonly done now, which is the nasal swab that you see, that is PCR, which stands for polymerase chain reaction. What it does is it looks for pieces of the RNA, which is the kind of the backbone of the genetic makeup of the virus. That's what they're swabbing for. The test amplifies that in the lab and then looks to detect it from there. Um, that's really the gold standard. It's what we do, although because we're doing so many tests in Texas, there is some delay. Most
Mhm.
of those tests are taking 48 to as much as 7 days to get results. However, during that time, you can, of course, still self quarantine. So the PCR test is what we think about as the nasal swabs. There's also an antigen test. What an antigen test does is it looks for part of the virus. So we think of the virus, the pictures we've seen as the big sphere. What the DNA test or the RNA test does is it swabs and it's looking for the material that's inside. The antigen testing is looking for pieces of the outside of that shell of the coronavirus to check. And the third type test we see is antibody test. And what an antibody test is it's looking to see if your body has been exposed and has developed an immune response. So the gold standard is the PCR swab test. That takes a little bit of time to come back, but it's we're on second and third generation tests. These are much more sensitive. If you test positive, you're for sure positive. There's not any false positives. If you test negative, 90% of those people are negative. If you're doing and there are some hospitals and centers that are doing quick swabs with a quick turnaround, but those are usually for people who are admitted to the hospital and severely ill who need some of the antiviral treatment or convalescent plasma treatment, which I'm sure we'll talk about later. But those swabs aren't readily available in the community. If you're going around Southeast Texas now, you'll see a lot of people offering fast tests, and those are the antigen tests. Some of the freestanding emergency departments and some of the doctor's offices have these. They have a turnaround that's pretty fast. These antigen tests, if it's positive, it's positive. You do have the disease. However, if it's negative, it's closer to 75 to 80%. So unfortunately, some of these rapid tests miss 1 in 4 to 1 in 5 people, sometimes because they don't have enough of the virus or they're testing too early from there. So when people think about getting tested, they need to realize that there's a lot of information, unfortunately, and people think or read that they need one versus the other. But your practitioner or physician should be able to help differentiate which is the best for you. Unfortunately, in our world of America with healthcare, there's always a cost associated with things. So a lot of it is cost benefit, also timing benefit as to what's necessary. Clear as mud?
Absolutely. No, well, I mean, that's good to know. It's good to know what's available and which one we should look for. Debbie's got a question. She wants to know, once you're positive, will an inhaler help with that terrible cough that comes with this?
Um, for the most part, yes. For most people who end up getting SARS, so the virus itself is SARS-CoV-2. That's a severe adult respiratory distress virus. It's named 2 because the first one was China in 2004. The virus itself is what we're testing for. If you develop then the lung disease, that's COVID-19. So we think of the virus and then the disease that it's causing. People who do get the cough, the albuterol inhaler is something that most doctors are readily prescribing. There can be some help from it. We are seeing some doctors who are prescribing some of the more classic or older cough syrups that you see to help. For the most part, because of how the inflammation in the lungs is working, it's not just like asthma or just like bronchitis or pneumonia where the inhalers will take care of the problem or help tremendously, although there is some benefit. So we do recommend that people who have inhalers, or if they go and get diagnosed, a lot of times they will get a prescription for inhaler and it can help with the cough. Unfortunately, it's not 100% knocking it out, but right now it's probably the best thing we have to help with coughing.
Debbie, I hope that answers your question. And we're going to be getting to some of these others too. Let's see. While we're talking about the disease, there are people that have reacted in so many different ways. I have personal experience. My husband and I both had COVID-19, and we were two that had the symptoms after, different symptoms. I had to go to one specialist, he had to go to another, even though we were exposed the same way. I know people who, a friend's father, they thought they might be exposed. He went and got the test, found out he had the antibodies already, and he never knew he had it. There are also people who have it, they're completely asymptomatic. Some people have it, it is like a flu and they get over it. Why are there, do you have any idea as to why there's so many different responses to COVID-19?
It's a very different virus. When you've heard the term novel virus, novel meaning new, it's not something that our bodies have been exposed to. So we're seeing responses on twofold. One, we're seeing the virus itself and learning that it can do lots of things. It can affect the brain, it can affect muscles, it can affect kidneys, it affects blood vessels and blood clotting. We see reports, hear reports from China, Europe, as well as the US, where even after COVID, people are developing strokes and heart attacks, blood clots, organ failure. These aren't things that happen with all people. In fact, they're not common things that are happening, but there are a lot of delayed effects we're seeing after the virus is over. So it's interesting to learn. From my point of view, realize that I'm trying to keep up with literature and learn, just as trying to stay this far ahead of where everyone else is, because it's an evolving learning process. But some of these effects are from the virus itself. When they initially get infected, that's where we think of the flu-like symptoms, the cough, the cold, but also developing things like diarrhea, fatigue, muscle aches, headache. The things that are developing afterwards were not initially expected, so we're kind of learning as we go. RNA viruses are a little bit tricky. There are many different viruses. RNA viruses are very similar to chickenpox, which is an RNA virus. HIV is an RNA virus. Herpes is an RNA virus. If we think about these diseases, they're ones that don't generally go away. They stay with you. People who've had chickenpox in the past are always at risk later on for developing shingles because the virus lives in the body forever. With HIV virus, people who have that, we've gotten to the point with very good drugs from keeping it away, but it never goes away. It's always within the body if people stop taking their medicines. People who've had fever blisters, which is a herpes virus, they just comes back with different stresses and things and doesn't go away. And so that's the fear with COVID-19 or the SARS virus, is that it doesn't go away. It just kind of stays around in the body. And so over the next months and years, we'll learn more about it. Fortunately, again, this seems to be pretty rare, but definitely things that can exist and we'll have to deal with as international healthcare over the years to come.
One of the reasons I felt comfortable in asking you that, it was related to a post I saw you make. I don't know how to pronounce this, but it is Cytokine storm.
Yes.
What is that?
So the cytokine storm is kind of the pathology or what happens within. Initially, people get the virus. I think the best way to look at it is with children. Most people are more worried about their kids, but fortunately, you don't have to worry about your kids as much. Your body makes different proteins throughout its life, and once people reach maturity, 16 to 18 years old, they produce a receptor called the ARB. The angiotensin receptor, is necessary for the virus to get inside of the body. Okay. Without that receptor, the body can't really cause the COVID-19 disease that we think about, the severe disease. So kids, for the most part, are pretty immune to it because they don't allow the body to respond the same way. But in adults, what happens is that receptor lives in the lungs. It also lives in the nose, which is why people complain of losing the sense of smell or sense of taste. That's one of the things that goes along with the virus. But once it gets into the lungs itself, the virus starts breeding and replicating. The body recognizes something's going on. Mm-hmm. And what happens is it creates this huge immune response, which is very similar to the body overreacting, but trying its best to shut things down. The cytokines are the signals for the body to do something. So if you're getting attacked by a virus that's coming in, the body says, hey, something's going on, and it releases what are called cytokines. Cytokines are just the different signals, the white flag, if you will, that, hey, there's an infection over here. But the body kind of forgets to regulate like it should, and it way over responds. And when all of these things start happening, the body then over responds. You get over inflammation, and it's similar in a way to autoimmune, how the body attacks for different autoimmune disorders. Not exactly the same, but then what happens is instead of having a normal response where here's the virus, the body comes along, takes care of it, all these cells start showing up, and then you have so much response that everything starts to swell. You get inflammation, and the body kind of attacks itself in the same area. So most people don't have this. What happens is the virus gets in, it starts doing the bad things that it does. The body regulates. People feel bad for a few days, but then they get better. With people who tend to be older or other populations, they get the cytokine storm, which is what happens when people get the severe disease. So the lungs go from normal healthy tissue that are inflamed to lungs that, how to describe it? They just look horrible. It looks like someone filled it up with water, more or less, and you can't breathe through water, which is when people start getting the severe problems and the lung problems that lead to, unfortunately, people being on respirators or something worse.
So to the folks who say, well, we have to be exposed at some point or another, it's just going to be like the flu. It doesn't sound like the flu.
No, it's how it reacts, and what it does is definitely not the flu. Fortunately, so far, with the flu, we always think of people who have complications are usually from developing a secondary pneumonia. That's usually the big thing that happens with flu. We haven't seen as much of these secondary pneumonias with this. It could happen from there, but the flu, for the most part, makes you achy in your muscles, but it's not specifically attacking the lung tissue. COVID-19 or the SARS-CoV-2 virus is attacking your lung tissue, and it's making a mess of things. But it also doesn't go away. It tends to be around, has effects later on. Flu, we're good at. We have vaccines for. Hopefully, we'll get to a vaccine at some point for COVID-19, but that's going to take time. I know there's optimism that we can get it by the end of the year. I would be surprised if we don't have it by the end of 2021. It takes time to develop something that's safe. But flu, definitely not. This is not there. To your original question, which is you need to get out there and get exposed so we can get past it. That would be great if we could get past it and develop immunity or even a short-term immunity, but that doesn't seem to be the case. Most people who get it will develop antibodies. But some of the Chinese literature and the other earlier literature out of Europe suggests that after you've had it, 4, 5, 6 months later, those antibodies aren't there anymore. So your body has lost the ability to recognize and be ready for the disease, which means you could possibly become reinfected. Also, there's, people say it's herd immunity. If we get enough people, we won't be able to spread the virus. In a sense, that's true. If everybody becomes infected, then you're going to have a short-term period where we're not going to be able to infect other people. However, because having the disease does not appear currently to provide immunity, if you're had it early and then we're spreading the disease along and then we get to December, now all of a sudden you're at risk for getting reinfected again. So unfortunately, it's going to become more cyclical and not have a finite end that we can take care of.
David Cook would like to know, David says, is COVID-19 spiking? Is this the second wave in your opinion?
As far as looking at a graph, we saw things start to go up and then things went down and now we're seeing an uptick. I think it is a second wave, but it's still a continuation of what's going on. We didn't get to the point where we were detecting no virus. If you look at China, they had their wave, they got it under control, there were no virus, and then they started to have another uptick a month later, whether that was people coming in or changing. I think that, yes, it's a second wave in the sense that we did an excellent job when we locked down and people were concerned. But now that we moved out, I don't think it's kind of we alluded to before we started the show. When the lockdown stopped, if we had gone out with caution, and I know there's a lot of discussion on social media, but continuing to social distance, continuing to wear masks, continuing to be vigilant about washing the hands, and still only went to places when we needed to, we would have kept things a little more suppressed. But we went from being locked down to let's go to the Mexican restaurant and eat chips and salsa, and everybody's there together. And I understand it's difficult for us. It was not fun at all to be locked down, but so much happened so quickly that we're no longer to the point where we can really contract spread. And so we're seeing that second wave. And just like people will kind of compare to 1918 and the flu pandemic, at the beginning, we could tell people came from. We would trace and say, okay, you traveled from here. We know where you went. You exposed these people. In most cases, we're able to be tracked. Because younger people are tending to be asymptomatic, now we're seeing so many people exposed that people don't know where they got it from. And that's where it's difficult. If you don't know you have the symptoms and you're not quarantining, then you're kind of spreading things. So I think we're into a second wave. Is it spiking? No, I don't think so at all. July 4th, we had a lot of celebrations, not as much as Memorial Day, but we had much more disease at the start of July 4th than we did. Memorial Day is way down here. We're all hanging out and people were free, but there was not much disease in the area. July 4th, the level of disease is here, and now we had more people, not social distancing. So we're seeing a spike, but we're not up that hill yet. We're still climbing. Where that stops, we won't know. I think around July 13th to 15th, we'll have a better idea, because that will help us with all the cases that occurred after the July 4th holiday weekend.
David, I hope that answers your question. Do you want to talk about how do you feel about the schools reopening? Nicole is asking that question. Heather Nicole, excuse me.
I think it's a difficult question. My kids are in the same boat. My kids are in the Houston area, one of the school districts there, and they have an option right now. At least we'll see. Everything's evolving, but they have the option right now of for sure going to school or doing an online option. And as I told my ex-wife, it's too early to, I think, decide right now. We need to see kind of what happens at least over the next 15 days, if not the next 30. Kids do well. I think, personally, I think, being classroom education, I think is great. Although our kids are all very digital, if they sat in front of a computer and we could actually keep their attention, they would do fine, because they've grown up with this. They've had a handheld mobile device in their hands since they were able to walk. Right. So they can do their things like that. I understand both. I understand the economy and the jobs and kind of keeping what we've always done. I think at the same time, when you have a tragedy or difficulty that's there, American ingenuity will find a way around it. So if that's online or not, those are always possibilities. I don't think everybody's waiting for all of a sudden for the virus to go away and for us to beat this. And I think we can recognize, since this has been going on now since March, that it's not going to have a sure end in sight. Kids, though, do very well. So even if kids get the infection, they tend to 99.9% have cough, cold, fever, a little bellyache, and then they get better relatively quickly. But do I want to have, my son go to school, then come back and visit his grandma, and then grandma gets sick? That's where the issues are. So it's the planning on what do we do at the next step. Is my child okay going to school and coming back? Sure. If we test everybody in the classroom and we find people who had COVID, almost assuredly, although most of those kids are not going to have symptoms. The younger you are, the less likely to have the symptoms. But it's what happens when the child comes home and then, possibly spreading it to people who are higher at risk. So, I can see it both ways. I would love to be super optimistic and say that by the time school starts, we'll have this thing down and under control and very low, and we'll be able to go to school. However, right now we're in a upward spike where things may be, much worse. I think it's too early to tell. I think, we have to put a lot of our faith in the leaders, hopefully to make some, smart and rational decisions. And I think if it ends up, like in my case with my kids, that here there's options of in school versus there, that I think a lot of it has to be done. Each family has to make their own decision on what's best for their children.
Okay. Heather, I hope that answers your question. We have another question from Christy Allen. What do you do if you find out that someone tested positive yesterday and you were around them Monday?
All right. So if they tested positive yesterday, and the question for them is, when did they start developing symptoms? But it's Friday now, so you're past that 4-day window from exposure. If the patient that you were around on Monday, was exposed also, maybe they were exposed Monday morning and you saw them Monday afternoon, the chances of you picking it up are going to be less likely than if the patient or your friend that you saw on Monday was coughing and hacking and sick. If that's there, then you're 5 days from being with them. You're at a good point to be tested. You just have to kind of see what your symptoms are. I would definitely quarantine if you've been around someone from there and look to see if you have symptoms. Of course, from my point of view, it's easy. I say, find some place then to get tested. And I understand how difficult that is right now, finding places that are doing testing and have quick testing. But whether you have the symptoms or not, the safest bet for anyone, especially if you don't have access to getting tested, is just self-quarantine.
Now, when you say quarantine, do you mean for 14 days?
Self-quarantine for 10 days. I think if you were exposed on Monday and you've had no symptoms to this point, and now you're to next week, Wednesday, or 5 days from now, and you still have absolutely no symptoms, the chances that you're, carrying things from there at that point are relatively low. The CDC will still tell you 14 days. Most people have gone to a modified 10 days. To allow people, because you're going up a plateau and then dropping off. Will you miss some people? Yes. But we also don't want you locked in your house for a month either. So it's kind of risk benefit weighing from there.
L'Oreal Irvine says, Baptist says, hey, Jeff.
L'Oreal, hello.
L'Oreal, I just ruined that name. Glad you're a doctor. You can fix that. Let's see. I know we have some more questions here. All right. Has there been any validity in the blood types and how they respond to the virus? I've seen that too recently. Like if you had O, you were less negative, less likely.
Mm-hmm. So interesting. So that's a lot of things too, is there's brief reports and data that come out, but a lot of things hasn't been fully verified. So interesting enough, if you look back to see where that initially came from, a lot of the data based on blood types came from people who did 23andMe. And so they have a list of all your blood types and things. And then looking back through and through data sharing, have been able to look and see who's been admitted, who's not. I tell you from my own personal experience, and when we have people who are in the hospital or admitted, we check blood types. It doesn't seem to make a difference anecdotally. Most people in the United States are O or O positive, whereas European and Chinese and have different predominances of what blood type is most important. We have O, A, B, and then AB. AB is incredibly rare. O is the most common. When you're in a homogenous group like the United States, where most people are O, it doesn't make O is supposed to be, at least from their initial data, which is very obscure. There's nothing to support it. There's no big randomized testing yet. Will there be? Absolutely. All these things that come out, most time in science, you get someone does a case study report. They say, hey, we looked at 10 people and we saw this. And someone goes, we need to study this. So then they get a great big trial that has tens of thousands of people. And then once you've looked at a much bigger picture from back here, then you get an idea of if it's true or not. Right now, we're looking at really small areas, and we're looking at data review, or called data mining, where they've taken data that they've got from people and saying, hey, is this, this is also happening. Well, the question is, are the two related? And that we don't know yet. That's like saying that pickles cause coronavirus because everybody who's ever had coronavirus has eaten a pickle in their life. Well, we all know that pickles aren't causing coronavirus, but that's the kind of thing you have to do. So I think that data may show some level of protection that's there, but it's not as big as we've seen the media report it to be.
Okay. Susan, thank you for that question. I hope that answers it. Here's another question for you. This is from Sandy. If you get tested to see if you have COVID, will it tell you if you ever had it?
It's depending on the test. If you're doing the PCR, which is the swab looking for the RNA, or you're doing the antigen testing, if those test positive, you currently still have, or your body's still breaking down the virus. If you do an antibody test, that will last longer. The goal is that if you were to live in a world where you got tested, or say you're a professional athlete, because we all see that sports are starting to move forward, they get tested every other day, and you'll test positive, and eventually you'll test negative. So if you kept doing tests, it should continue to be negative unless you're getting reinfected. Those normally is how long your illness lasts. Most people, 10 to 14 days at the most. You probably have still test positive up to about 3 weeks, in some cases 4, but less than that, your test would then become negative. So if you're testing the swab that goes in your nose and you think you had symptoms in February or March, it's very unlikely that test would be positive. If you're getting a positive test now and you were sick back in March, you probably have the virus now. The antibody testing can last for months, But what we're learning is that after time, those antibody tests will also go back to normal. Hope
What
that helps.
if you donate in plasma the antibodies?
That's good. So if you are recently recovered, and I'm not sure the exact amount of time, I want to say it's 2 or 3 weeks after you've recovered, your body is still producing antibodies. The absolute best response we've seen, more than the viral treatments and the drugs and different things, is what we call convalescent plasma. When people donate blood, blood has two components, the red blood cell part and then all the liquid that's there with the red blood cells. But in that liquid component, your body produces antibodies. If you've had any infection, your body's producing it. So people who are shortly after they've recovered, they're no longer having the virus, their body's still producing antibodies, at least for a time being of a couple of months. It's imperative that people who have recovered, I say imperative, but I mean, it saves lives, is to, go and donate plasma. What we're finding out is if that plasma that we collect from you can be given to someone, it can actually help save their lives. So the plasma is incredibly important, but it doesn't last that way forever. Again, just like your antibody testing, over time, your plasma is not going to have the antibodies as the body starts kind of going back to normal.
If you donate the plasma and you give those antibodies, which are very important to the folks who can't fight it alone, does that mean you no longer have the antibodies? Your body
No,
is not
no,
making
you're just
them?
taking out a portion. It's like donating blood. You'll give a unit of blood, and then they'll remove the plasma and the antibodies from it back in the laboratory from there, and then your body will continue to regenerate things. And essentially, you will be donating, blood. They'll probably use the blood for, regular blood supply and those needs that we always have as well.
Okay. A lot of people are asking if you can get it more than once, but you pretty much already said that people can be reinfected. Yes.
We're so early in the game that it's hard to say for sure. There have been a lot of reports of people who have. We're assuming based on the reports that it is possible. Time will tell. We're 6 months into this thing, and we don't know what's going to happen come the winter time. Ideally, it would be absolutely wonderful if everybody maintains some of that immunity, because once we get into flu season and have two different things going on at once, it's going to be interesting to kind of ease out what's causing it. But
Robin
it can't.
has a question. I'm sorry. Did I stop you?
No, please go ahead.
She has to have a colonoscopy next Friday, not at a hospital, but she's still concerned.
No, I think you should be okay. The physicians' offices, as well as the hospitals, have instituted wonderful abilities to kind of check and do things. Most hospitals and other things are checking people beforehand, but your providers and everybody that's in your room for your colonoscopy will be wearing masks, they will be wearing gloves, all the equipment will be sterilized. Of course, with COVID going on and where I work, my mom is, of course, worried about me. And so every day she's like, that's where you're going to get sick. And I tell her, I'm not going to get sick at the hospital. We've got gowns, we've got masks, we've got more personal protective equipment than anybody else does. It's going to be when I, get around someone accidentally at a grocery store or post office or somewhere else that I'm not thinking is where I'm more likely to pick up the virus. The hospitals and settings are very well taken care of. And so I don't think you should worry about having your colonoscopy.
Robin, I hope that eases your mind, and good luck with your procedure. Leslie just has a comment. She said, best care is absolutely the best place within miles. The doctors there actually came to her daughter's car to check on her son's burned hand. So that's nice.
Yeah. Thank you so much. I'm glad we were able to be there for you. Thank you.
Okay, we're going down a little bit further. What does the positive IgG and the negative IgM mean?
Great question, Brenda. There are actually multiple antibodies. IgM is the more immediate. It's how your body first reacts to something, an infection, and then later on produces IgG. Those are more mature antibodies that are there long after. So if you are IgM negative and IgG positive, that means your infection is more likely more remote, probably more than a month old. You still have the IgG, which is what we're getting out of plasma for people who are donating. That's what protects you for the long term or the longer term. The IgM is short term, but that just kind of helps us time how long ago you were exposed. If you're IgG positive and IgM negative, your infection was probably more than a month old, if not 2 months old. that's kind of just guessing when your symptoms occurred based on those test results.
Brenda, I hope that answers your question. Thank you so much. Okay, let's see. Got another one now. An infected person touches things in an office setting. How long will it last on those things if not wiped down? Now, that's a question. They were saying it lasts for a long time on metal, then maybe not. Is there been a consensus on that?
The consensus are based on what we call in vitro studies, which are putting different virus samples on things and then testing at a later time. Um, most the most common thing is still going to be droplets. It's when you're coughing or come into direct contact, not airborne. That's why masks are actually somewhat helpful. Most of the virus clings to water droplets, so the mask will actually slow some of those down. Aerosolized is things that just moves freely, and though we have some of that, the disease is not a perfectly aerosolized. But when it gets on substances, different substances allow things to last longer, and a lot of that depends on the water content. A virus will dry up just like anything else, so it really does need to be in some kind of moisture. If you look there, I think the CDC will actually have guidelines that you can look up based on what kind of material, how long it could potentially last. Most things are actually in the hours and less than days. There are some substances longer. So it's always a good idea to wipe things down. I find this question happens a lot with people who go to different stores, grocery stores, or other where they're picking up things and maybe people are putting it back, and that's where the concern is. One of the benefits of wearing a mask that people don't talk about is not just coming in contact, but the virus has to get in through your nose or mouth. You have to breathe it in. If someone had touched something and put it back and you're wearing a mask and you touch it and do things, and this is much more common for men because we don't wear makeup, so we're always touching our face. Women who wear makeup have learned not to touch their face, which is wonderful. But if you're wearing a mask, you're not touching your face, you're not touching your nose and your mouth, so you're less likely to spread things. But as far as directly to your question, how long before it should be wiped down or in between, it will die on every substance in time. It's just a matter of that time. I think if you look at the CDC guidelines, you should see a good breakdown of what kind of surfaces. But any cleaner that you're using, Lysol, Clorox wipes, the generic versions of the same should be perfect in between.
I think we have time for one more. And Joey has asked, where would one donate plasma?
You can contact the blood banks or each of the hospitals. They can help direct you. The health department should be able to help you as well. It's an excellent question. There are a lot of people who recovered that may not know about the plasma therapy, but it's life-saving. I think your best thing to do would be to contact the blood bank, then the county health department that you're in, and then either the hospitals in your area, whether it's the medical center, St. Elizabeth's, or Baptist Hospital of Beaumont, and they can help direct you on where to donate plasma. Excellent question.
Dr. Thompson, thank you so much for all of your time today. What's like the most important point that you would like to get out there?
I think the most important thing is to know that we are in the middle of a pandemic and crisis, to be cognizant of what's going on around you. I think if you approach things with caution, you'll do fine. If you wear a mask, if you wash your hands, if you practice social distancing, and though we want to get out and do things and vacation and do summer things, if you limit your exposure to other people, we're going to get through this. It just has to do with caution. Wash your hands, wear your mask, social distance, be protective of others.
Thank you so much for your time and for great information. I really appreciate it. And I know everybody that's watching does. Thank you.
Absolutely, my pleasure.